been my pleasure to be an anti-aging regeneration physician over the last 5 years. I have had the joy of creating people's lives being transformed from one of being frail, poor health in terms of sleeping, emotions, energy, brain clarity, and reversing all that. And I can do that consistently for men and women. Men and women both have issues with aging related to hormones. Women have it very quickly. When they go into menopause, in a period of just a year or two, they change from being a vibrant, dynamic, young individual to becoming old. Men have it more gradual. It happens over a period of years, but every 5 years they feel older and older and older in terms of their brain, their enthusiasm, their energy, their muscle strength. And all this is reversible. And it's my joy as a physician to create that happening for people. And I can do that in a consistent way, which is safe and effective. What I do as a physician to enhance aging is something that can work for people of many different ages. There are many women who are in their 30s and 40s who have some lowering of hormones, not to where they're in menopause, but where they don't sleep, where their moods are uneven, where they don't feel a sense of vitality, and that is also definitely a reversible situation with bioidentical hormones. As we lose hormones, we have many different symptoms that can appear. These are symptoms of changes in our brain, in our memory, in our clarity of thought, in our quality of sleeping, changes in our overall muscle strength and vitality and endurance, changes in sexual functioning, sexual enjoyment are all part of the process of losing hormones. We don't know why people have to lose hormones. It does seem to be a factor that occurs from a certain kind of genetic program. This can be changed through the replacement of natural human bioidentical hormones. This is very different from the hormones that we replaced 25 years ago. These were synthetic hormones and/or animal hormones that had all kinds of funny side effects. Side effects of producing cancer and heart disease, side effects of producing strokes. We don't find any of those side effects. As a matter of fact, the studies in 2013, 1,000 women in Europe, over 15 years, 500 women in the United States over 5 years, both showed that compared to doing nothing, women who took these natural bioidentical hormones lived longer and healthier than women who did nothing. This is a very dramatic finding. Every woman and every man as they get older will benefit from maintaining youthful levels of hormones. We now can measure the levels of free hormones in the blood rather than just the protein-bound hormones. These correspond to levels of hormones that are naturally found in your cells. When we measure these levels in saliva and/or in urine, we can tell what your level of hormone is. If your levels of hormones are of a 60 or 70-year-old, your doctor may say this is normal for you, but in fact, it's making you feel old. We can reverse this and get your levels back to where they were when you were a more youthful person, and you will feel dramatically younger, both in terms of your brain, in terms of mood, energy, enthusiasm, less depression, and in terms of your physical strength and physical endurance. All these things come with a more youthful level of hormones.